See, there you go again, talking about your children every time. We live. Okay. Hey, y'all, we gonna get
Hey,
this together. Whenever we start being live, either I'm talking to my son or Tanisha's fussing at one of her children. We gonna try to get better.
I know. My son be on them video games and he be projecting and yelling at folks on the video game. I'm like, boy, close your door.
Right, right, right. And thankfully, my little king, my little Yakin, is not here. He is with his Paul this weekend. And mommy has gotten to spend some time by herself. However, I was asked to talk about nature-based medicine versus traditional medicine. And I think we're gonna deal with that a little bit today. Let me tell you, first of all, that my first job, 17 years of age, I was working at a hospital called Texas Children's Hospital. And I worked in medicine for nursing administration from the age of 17 all the way up until the age of 36, I want to say, or was it 37? It's some 30, probably 37. And Tanisha here, my counterpart here, she also has a background in medicine as well. Am I correct, Tanisha?
I've been a nurse 29 years and I worked in the medical field since I was 15, which was a long, long time ago.
Oh, 15, girl. God.
My grandmother was a manager, and so I got this little part-time gig when I was 15. Mhm.
Wow. 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 Wow.
I've been in the
So
hospital for a long time.
yeah, I was in the hospital for a long time as well. So being around medicine, having this mindset that if something goes wrong within our bodies, there is some type of drug or some type of pill that can fix it. Was my mentality for years. That was my mentality. In fact, I grew up on that mentality even before I started um, being in the medical field. My mother, I'll never forget. I was a what some would consider a sickly child. I would be in the hospital for months on time, having walking pneumonia, having a blood clot. There was always some shit going wrong with me. Always some shit going wrong with me. And I'll never forget, I was probably around eight. And my mother, she was in a situation where she needed me to go and stay with my father for a little bit. And my father picked me up, and my mother told him I had a suitcase. It was a little green suitcase, y'all, with a little green handle. Yeah, yeah, one of them old timey suitcases, y'all. And my suitcase was filled with medications. And my mother told my dad, she said, Mike, now these is Tiffany's medications. If Tiffany don't take these medications every day, she's gonna die. She's gonna die. And I believe what my mother said. So can you imagine my horror as soon as I got to my father's house that next morning when I awakened and I was ready to go and get my medications? He threw all my damn medications in the trash. I thought that motherfucker had lost his mind. That that motherfucker, I'm like, well, I don't know what type of religious bullshit you on, but this is my life here. And I am gonna die if I don't have this medication. Well, I'm still alive, y'all. I'm still alive. Now, I don't recommend what my father did. That shit was very traumatizing for me. That was very traumatizing for me. I do not recommend what he did. However, he put a new belief system in me. And here's the belief system that he put in me. He would make me get up every morning. Now, my dad, religious, y'all. And he would make me say, I shall live and not die, and I shall declare the works of the Lord. And after doing that for 3 months straight, when I came back to my mother's house and she tried to give me all these medications again, I realized that I didn't need them. I didn't need them. Okay. And that kind of psyched me out a little bit because it's like, well, what the fuck happened? I was told that if I didn't take these medications, I would die. But there is something to be said about the power of belief. Whether you believe in it or not, there is something to be said about that. I worked my first job in the medical field. I worked at Texas Children's Hospital and I worked for a surgeon. A surgeon. I worked for Dr. Cooley and Dr. Charles Fraser. And they would help children that had holes in their hearts. That's what they would do. And on several occasions, there would be a x-ray that would show a hole in a child's heart. I don't know what you say, what you want to call it, but these same parents would come back with this same child, and then this hole would not be in their heart anymore. And they said it was the power of belief and prayer. Well, at that time, I said it was some bullshit. That is what I said. That is what I said. But then I started getting really sick later on in my life. I started having strokes. I've actually had 4 strokes. 1, 2, 3, 4. And I know what you're thinking. You're thinking, oh no, she couldn't have had 4 strokes because she would be dead. I'm not dead, you guys. I've had a pituitary tumor that I no longer have. It was a big ass tumor on my brain. I no longer have that. Oh, people are texting me. Okay. So I no longer have that. So the reason why I'm talking about this, let me turn my phone off right quick. The reason why I'm talking about this is because one of my moderators posted something within our group, and it talked about the body having a preference to know how to heal itself. And then people were saying, hey, you got to be careful about that because I have COVID and my sister has COVID, and some of us need medication. Do what you need to do to heal your body. Do it. But if you want to know, see, I found it. Here was my problem. This is my body. This is my body. Why is it that a doctor can know more about my body than I know about my body? After I had my second stroke, I realized that my body had been trying to communicate to me, but I was not listening to it. And I was not sensitive to my body because I didn't really believe in taking care of myself. As an empath, I believed in taking care of everybody else except me. And the body is constantly communicating to us daily. But the question is, can we really hear it? Are we so dull of hearing that we cannot understand what our body is telling us? So I started reading books. Here's the first book. Feelings Buried Alive Never Die. Let me put that on the screen. Feelings Buried Alive Never Die. I read this book years ago, but what it has is it'll have symptoms, any kind of disease, and it will tell you the emotions that are tied to the disease. And if you start working on the emotion, once you heal the emotion, the disease goes away. Now, as I said, I'm a little bit on the skeptical side. So I said that was some bullshit, but I decided, let me try it anyway. So let me see what it says for stroke. Okay. Now, Tanisha, what you think it might say for stroke? What feelings could be associated with having a stroke?
I would say stress.
Listen what it says, you guys. Here are the feelings associated for having a stroke. Rejecting life at a deep level.
Mm-hmm.
Extreme resistance. Impatience with self for not improving a situation. Impatient for not being able to perform like you want to. Self-violence.
Oh, sound like a perfectionist.
Don't be in my shit right now. Don't be in my
You.
shit. Anyway, feeling overloaded with the pressures of life. Feeling like giving up. Now, when I read this for the first time, I'm kind of violent sometimes in my emotions. So I threw the book across the room. I was like, fuck this book. Fuck this book. That's what I was like. But then I started really asking myself, extreme resistance. What am I extremely resisting? And here's what I was extremely resisting. My heart and my soul have been telling me to get out of my marriage. Y'all, I was not feeling that shit. I was not feeling that shit. It kept telling me that the energy that was being created in my marriage was not healthy for me. But I had these illusions in my head that people would think that I was a failure if I gave up on this relationship, if I gave up on this marriage. So instead of me listening to what my heart and my body was saying, I cared more about public opinion. And that manifested as sickness in my body. I kept trying to improve it. I had to go ahead and deal with that. I also read these other books. It's called The Dynamic Laws of Healing by who's it? Shit, can you see this? Yes, by Catherine Ponder. I've read her book as well. I've also read uh, Instinct Based Medicine by Dr. Leonard Caldwell. Now, listen, when it comes to medicine, I think that you need both. I think that you need to understand your body well enough to hear the clues and the messages that your body is telling you, and you need to
Mhm.
respond to your body. You
Right.
need to respond to your body, okay? But if you are at the point where you do not know how to listen to your body, you don't know what the fuck your body telling you, go your ass to a doctor. But it's not one
Absolutely.
way or the other way. You need
You
both.
know, you know what else though, Tiffany? I think search out a doctor that doesn't believe that medicine is something that you do long term.
Ooh, I like
One of the things that, people get stuck on is I see people that are on blood pressure medicine for life. Find you somebody that says, I'm going to cure your high blood pressure and we're going to work on this, because they'll just keep prescribing it and say, how's your blood pressure, and keep prescribing it, and you've looked up and you're on it for 10, 15 years, when had they fixed the problem, you could actually get off of the medicine. And that it takes a different type of doctor. It takes spending that time with them, and they'll, work with you like that.
I
But
don't really find those doctors in Western medicine.
there's some, and you know what? Part of that also goes with when they spend time with you. Now, right now, if you go see a doctor right now, there's no reason why they can't spend time with you. They're not seeing sick patients.
I agree with you. I agree with you. When it came to my baby, I actually I sought out Indian practitioners. I did, because I think that in order for a doctor to be balanced, a doctor has to encourage a patient to listen to their own body. They have to do that. Okay. Now, if I break a bone or some shit like that, you better believe I'm going to the goddamn doctor. I'm going to a doctor. So seek out your physician's help, but don't use your physician as a crutch. You should know your body well enough. You should know, okay, if I eat this food, my body doesn't like that. This food gives me hives. But you see, we are so busy. Let me see what Dr. Caldwell said. Let me see if I can find this definition.
Find that, and then I think another way of approaching what you're saying is to treat your, like, when your body's allergic to something and you stay away from it. You're conscious of it. You ask, hey, I'm allergic to strawberries. Is there any strawberries in that?
Yeah.
Think about some of the things that you need to avoid, and that take that same approach towards it.
I think I like that. I like that a lot. Okay,
Hmm.
so this is what Dr. Leonard Caldwell says. He says, a drug is anything you use to remove the effects of transgression without requiring obedience. Let me repeat that. A drug is anything that you use to remove the effects of transgression without requiring obedience. Listen, that is how I use doctors. I would transgress against my body all the time. And then I would go to a doctor because I didn't want to feel the symptoms of my transgression, and ask my doctor to get rid of my symptoms because I did not want to listen to my body. If you are doing that, I encourage you to stop. I encourage you to stop, because I swear to you, your body will communicate with you if you sit your ass down enough to hear what your body is saying. Now, if you were like me and you haven't listened to your body for a long time, it's kind of like dealing with a woman that you have suppressed her voice for so long that when you finally allow her to speak, she come out swinging. It's kind of like that. It's kind of like that. So do it slowly but surely. Understand your body. Understand that it has a preference to heal, but also understand when you need to go to a doctor. We love you guys. I have to get ready to starting one of my coaching meetings. Is there something else you need to say, Tanisha? There's a
No, I agree with all of that. Let's see, as far as the medicine and treating your body like like you do if you have an allergy, and the source provided medicine as well. We just have to be mindful of how we take it.
She's trying to tell you the front door was locked. Bye, guys. We love you guys. We'll talk to you later. Bye.